should be based on what the CEO MD has set as the focus point of discuss so that we can get it right. Brother Solomon, please.
Yes, please. To the podium, representative for the PHC heads from Gbagada Environs. In 5 minutes, you have the floor. Please do we have the PHC heads from Gbagada Environs. Immediately after.
They are our stick. Use this mic. That one don't fail us. Mickey
So,
Mike. My brother, oh yeah.
As it's been placed down for us, all right, we're going to have the PHC heads from Gbagada Environs. The mic is yours now for 5 minutes to have maybe you address your questions or so. And while our panelists are still here, should in case you have a question that you're going to direct to them, as instructed by the MD as well, so that they can have to attain to those questions. Thank you. The PHC heads from Gbagada Environs.
Do we have representatives here, please? Ewambi Abesimbi is a stakeholders engagement from PHC, Gbagada Environs, the community, the CDS. Ajal Rashidat. Hazan. Emma Boma. Emma Chiju.
I'm just going to start while I'm sure the MOH and her team. I can see the medical officer of health, Dr. Oguntoyibo here. And I know that others are also in the room. First, it's going to be more of comments and to also congratulate the organizers, starting from the medical office, the MD, General Hospital Gbagada, Dr. Babafemi, and of course the organizers of this very, very informative discourse, Dr. Adegboyega and her team. In fact, I think I've listened to so much. And of course, when you have experts in the room sharing from their wealth of experience and wisdom, you can only both, bask in all of it and then dwell and look at, okay, how do I want to contribute? I think it's going to be a lot of disservice if I do not mention that at the primary level of care, at the Primary Health Care Board, last year we had already commenced we had inaugurated the community MPDSR, and this had also been cascaded down to IFACO, local government LGA, and Ikorodu LGA. I know that plans are underway to also scale this up to other LGAs, and it's something that is worthy of note, and it's something I would also recommend because I strolled out, and when I came in, I heard you talking about it. I think as a policy, it is something that we should encourage, that handshake between the primary level of care and the secondary. You cannot get community MPDSR working if you do not work with the PHC. And why do I say so? PHC is all about preventive health. And when it's preventive health, we're also looking at all the relevant stakeholders. You have all the clinicians there, but like you said, everybody matters up to the gatesman. Up to the gatesman. They know the people in their environs that is not doing something right. They know that woman that is going to maybe the patent medicine vendor or even accessing drugs from, the not too right places, and they're not right asking them why or where's your prescription. We see things like fetal alcohol syndrome coming up. With depression that is on the rise now, you will find pregnant women doing drugs, abusing drugs. This will ultimately affect the fetus. So how do everybody here come, how do we come into play? How do we ensure, how do we take part in making sure that this does not become a scourge? That's where the C-MSDSR comes into play. We need to work together and say, if you see something, say something. That is what this is all about. You see something, you say something, and we need to do that. In addition, one thing that we've been talking about at the PHCs, at the Primary Healthcare Board, that has been a challenge is data, community data. What we have now is more of DHIS, and they are facility-based data. And because we have only facility-based data, you cannot work on what the numbers of deaths that you are gathering from the community. why, what is the cause of those deaths and what or what not. So you need to put all of this together. The kind of database, that kind of framework, I know they're working at it at national, but this is Lagos. Lagos is noted for excellence. How can we come together, our HMIS units, sit down and draw up something where everybody can fill in the numbers as to, you look at the indicators that you want to gather, and then we can be working. That means we also must